Hello, I'm April Wilson from Loma Linda University. I've been able to spend the last several months working with our team in COVID response and preparedness for our institution and our university. In that role, I work with employee health and student health as chair of the preventive medicine department. I'm going to share some information with you today about COVID to help bring you up to speed on some of the details that are breaking and that you may not be aware of yet, as well as some of the foundational knowledge that we've accumulated over the last several months. This is a picture of the coronavirus. It was first identified in Wuhan, China in December 2019. It initially was thought to be linked to a large seafood and live animal market, but later analysis indicated that actually that was not the case. It had actually spread person to person. And as people began to travel in our globalized world, the virus began to spread to new countries and cities around the globe. The disease itself is called COVID-19. The virus is named SARS-CoV-2, and it is one among the family of coronaviruses. So there's many different types of coronaviruses. This is just one of them that has emerged in the last year. Coronaviruses, and this one in particular, COVID-19 with the SARS-CoV-2 virus, primarily attacks the lungs. But it can sometimes impact other systems as well. For example, the upper respiratory system, the heart, the GI tract. Sometimes people have skin manifestations with rashes or other types of eruptions on the skin. It can cause inflammation all over the body, much like influenza, where you just feel really yucky everywhere for a period of time. This graphic displays the symptoms that were common in a group of 164 symptomatic patients from the US with known onset of the disease between January and April 2020. 96% of the people had either fever, cough, or shortness of breath. Furthermore, 45% had all three of those together. Cough alone was present in about 84%, and at least 80% of people had a fever. So you can see that those were fairly common in this group of individuals. And there are some other symptoms that are less frequent, like the sore throat, the runny nose, stomach symptoms, others like that. But overall, the fever, cough, and shortness of breath emerged as the commonalities, and that's why you hear about them so frequently when people are screening you at the entrance to businesses or in CDC updates and such. So primarily, as we mentioned with the Wuhan situation, this virus is spread from person to person via droplets. And that is one gross picture, isn't it? So somebody coughs, somebody sneezes, this virus goes out everywhere and settles on those who are within a distance before the droplets fall to the ground. Now, there's been a lot of talk about how far these droplets can travel, but in general, we have decided to go with a practical distance of about 6 feet as a recommended distance to try to avoid these droplets getting on other people. And these droplets are produced when we talk, when we cough, when we sneeze, when we sing. So there's a lot of different ways. Anything that happens vocally or from our mouths, where our mouths are open, tends to make these droplets come out. Those droplets can then land in the nose, the mouth, the eyes of other people that are near us and infect them. Sometimes those other people don't actually have any symptoms at all. They might be infected but be asymptomatic. And how easily that virus, spreads between one person to another, that can vary. Some viruses are really highly contagious, like measles, and others don't spread as easily. This slide shows if there's one sick person with this disease, how many other people can they infect? So each of these boxes represents a person, a unit. And so you can see the typical person with Ebola infects 2 other people. A few years ago when we had the H1N1 version of the flu virus, it would infect about 1.5-ish people. There's some variation here. You can see measles is highly infectious. It would typically infect about 15 people. COVID-19 is actually relatively mild in this regard, in that it only usually infects 2 to 2.5 other people. And this goes along with or aligns with the fact that we believe and have documented evidence that it's droplet spread and not airborne transmission. Part of the reason that measles infects so many other people is because it can hang in the air for hours after you leave a room. You walk through the room and then you breathe in those airborne droplets. However, when those droplets settle down onto surfaces, when you walk through the room a few hours later, you're not at risk of bringing that into your lungs or your mouth or your nose unless you're wiping those surfaces and then touching your face. So that's part of the reason for the emphasis on masks and hand hygiene, etc. So what if you get exposed? At some point if you haven't already been exposed, at some point in the next few months, you will be. And when you're exposed, you need to do something. What do you need to do? You need to quarantine. And I've made these scales balanced and made the quarantine side of the scale actually heavier because that's the most important part. Now, everybody kind of understands when they get exposed that they probably need to separate and step away from others. But a lot of times they think, I just need to get tested and then I won't need to quarantine. Well, testing may be helpful. It could help us to identify other early cases of disease, but we can't do it too early. So if you just got exposed, if we test you tomorrow, most likely we would get a negative, even if you're going to be positive later. So we recommend that if you get tested between days 5 and 7 after exposure. However, that doesn't mean that you get out of quarantine. There isn't a get out of quarantine free card at this point. You have to continue with the quarantine for the full 14 days. What if you get sick? What if that exposure turns into an illness? Maybe it's COVID, maybe it's not. You don't know till you get tested. What should you do? Well, there is a CDC symptom checker, and I've put the link on here that you could go there and check it out, or you can just Google CDC and their symptom checker and try it out. It will actually give you advice in terms of making a decision about whether you need to seek testing or appropriate medical care. So that's a good place to start if you're not sure. I would also recommend that you stay home, except for when you're seeking medical care, that you separate away from other people, that you monitor your symptoms daily. So don't just kind of drift along and ignore them. Actually look at yourself, think about yourself daily. How am I feeling? What level of symptoms do I have? Are they better or are they worse than the previous day? If you make a decision to seek help with a medical professional, please call ahead so that they're aware and they can plan and the office can get you set up. Some offices are doing telehealth as the primary way of managing patients who have COVID-like symptoms. So it'd be important for them to be aware and so that you don't waste your time or get frustrated by not being put into the correct queue in the system. Please wear a mask. Now, generally, we recommend wearing a mask or a face covering at times when you are out and about in public, and when you're home with your own family or in your own car with others that are part of your small group, you could take your mask off. However, if you have symptoms, please wear your mask at all times because that will actually reduce the risk of anyone else in your family getting sick from you. So in addition to spending that time away and trying to quarantine, if you need to go into common areas, wear a mask. That will be very protective for those around you. Make sure you cover your coughs and your sneezes just like your mom and your first grade teacher has been saying to you for years. Wash your hands, clean them often, use hand sanitizer. Avoid sharing personal household items, and that may also be school items for many of our students. So cell phones, pencils, laptops, all of those types of things. Make sure that they're cleaned carefully before you utilize something. And ideally, you would have your own item that you would not share with others. And then finally, any high-touch surfaces, so things that maybe you're not sharing but are doorknobs, bathroom sinks, refrigerator handles, just some of those things that you're sharing in common that you're maybe in a break room at work or other places like that get touched frequently. Just wipe those down daily to reduce the risk of any viruses spreading to others. So, you get a test. You had some symptoms, you get a COVID test completed, and then the result comes back. You are positive. What happens now? Do you quarantine? No, you don't. The term changes. When you develop symptoms and you now have confirmed COVID, we change from quarantine, which is separating exposed people from non-exposed people, and instead we say we're going to isolate you. So how long do you have to stay isolated if you have confirmed COVID and symptoms? Well, the answer depends on how significant your disease was and your health status as an individual. So if you're fairly healthy and you have mild disease, 10 days is generally sufficient that you're not going to spread that disease to anyone else. But if you have immune compromise or other severe symptoms, maybe you've been a transplant recipient, and or if you have very severe disease, you've been hospitalized, then your physician may decide that you need to be in isolation a bit longer. And so then it might be 15 or 20 days. Currently, the CDC guidance says 10 days for mild and fairly healthy people and 20 for others. However, this is subject to change, so please continue to stay attuned to the evidence on this because it has changed many times since the evidence first started coming out in April, and we've continued to follow. So this is just the status as of mid-September 2020. Now, what about testing? What if you get tested after that initial positive test and it comes back positive again? Maybe you get tested at day 10 or 12. Well, if you're a healthy person with that mild disease, you actually don't need any follow-up testing. And we have found that testing farther out, many times we'll get a positive result. But that does not actually correlate with that person being able to infect other people. And so that's why we now say you don't need to do additional testing after that initial positive test. And we can end the isolation at 10 days without that test. You can safely go back into the community, be with your family, be with your friends, and with really no risk of infecting them. We can never say the risk is zero, but it's very close to zero. It's very safe. So what about protecting other people? What can we do to keep those around us as safe as possible? What can we do to keep ourselves safe? Well, CDC has this lovely graphic about practicing social distancing, which many people joke is not that social. We should call it maybe physical distancing, but regardless, we've all come to the agreement that about 6 feet seems to be the reasonable, practical balance of science and what we're actually able to do in real life. It's not very practical to stay 30 feet away from people, so 6 feet is where this has landed, and as much as we're able to, this does protect to some degree. Droplets will tend to fall to the ground, and you'll have a far lower amount of virus that would land on you should someone across the room sneeze. Now, what else would help? Oh, well, if they were wearing a face covering. If they're wearing a face covering when they sneeze, there's going to be a minimal amount of virus that's actually going to come through that face covering and be able to come to you 6 feet away. So putting those two pieces together is actually very beneficial, and we want to, as often as we possibly can, have multifaceted approaches to prevention. You don't want to just have one thing keeping you safe. You want to have as many different components as possible. So some of the additional components include washing your hands. That way, if you take that mask off after somebody sneezed, or if you touch the doorknob that somebody else sneezed and then touched that doorknob, you're going to wash your hands afterwards. You're going to hand sanitize and remove that virus or kill that virus while it's on your hands. And so we've seen more and more evidence that surfaces and things we call fomites, which is just the fancy doctor word for objects in our environment, when they get virus on them, virus doesn't do very well out of our bodies. It can thrive inside our bodies. When it gets out on these surfaces, it doesn't live very long. So it is good to clean. It is good to disinfect. I don't want to downplay that, but at the same time, I think in the early days where everyone was wiping their groceries down because we were afraid that something might have survived for 7 days or 5 days, we're kind of moving away from that and recognizing that that's probably not where the greatest benefit is. The greater benefit is in keeping a distance and wearing our face coverings or masks and washing our hands regularly. In addition to all the other things we've discussed so far, face coverings, social distancing, hand hygiene, cleaning and disinfection, self-monitoring to make sure that when you wake up in the morning, you're not coming down with something and just ignoring it before you go to work or school. The other thing that can really help slow the spread of COVID is contact tracing. And so you've probably heard public health across the nation is ramping up to respond to this. They're hiring contact tracers, and we have contact tracing teams here on our own campus at Loma Linda. In the past, this would typically used on a much smaller scale. Maybe we'd have a tuberculosis patient who wasn't diagnosed initially, and then we would go through the process of actually informing the people who may have been exposed to that particular patient. Well, now we're doing it multiple times a day when we learn that an employee or a student has COVID, and then we contact those that they may have exposed. And we actually go back 48 hours prior to the positive person developing symptoms or getting that initial positive test, because that 48-hour or 2-day window prior to symptom development or positive test is actually a time when they could be infectious and not even be aware of it. So we utilize those guidelines and we look at anybody they've interacted with during that window. And then we tell them, hey, you might have been exposed. You need to quarantine. Those who are essential workers, as long as they're asymptomatic, are able to continue to come to work. But we encourage them to be extra careful in their homes and community, to keep their masks on when we provide them resources for testing. And this is happening at a similar level and probably larger level. We're just doing our own little campus, but it's happening across the whole nation. And this enables people who've been exposed to be more careful, to wear their masks more frequently, to be more careful with their hygiene, to monitor themselves. And all of that together reduces the spread of COVID. It slows it down so that hopefully we're not infecting that 2 to 2.5 people. Maybe one person is only infecting one person, or on average, people are infecting less than one person. Maybe 10 positive people only infect 8 other people. And as that number becomes lower and lower and lower, we'll begin to see this epidemic and pandemic curve begin to come down instead of going up. So that's kind of where the magic is in improving and getting out of this particular pandemic situation over time. Here at Loma Linda specifically, we have implemented all of that contact tracing. We have also done things to try to make our own campus as safe as possible. So we pre-screen students who are coming to campus. We ask them about symptoms. We ask them about exposures. We ask them if they have high-risk conditions, because we want to be able to advise them about that. Try to keep them as safe as possible when they're on rotations and such. We also have daily screening. So if you're in a clinical setting, you'll get a forehead temperature and you'll be asked questions about your symptoms. If you're in a non-clinical setting, you'll have an app on a phone that you'll answer questions and then show a screen that shows that you're cleared before you come through the door or at the beginning of a class. So we have a lot of processes in place to keep our campus as safe as possible for all of our students. One of the questions that has been asked is, how has COVID-19 affected admissions for colleges and universities? And our colleagues at Andrews are going to weigh in as our experts on this particular question.
Hi, I'm Wendy Keogh, Executive Director of Recruitment and Admissions at Andrews University. Your Adventist universities empathize as many schools have been forced to make changes, and we want you to know that we are your higher education allies. We are here to support you in light of so much that is out of your control. Typically, the steps toward university admissions are: number 1, completing an application; number 2, submitting your high school or college transcripts; and number 3, submitting your ACT or SAT scores. Submitting your application has not been hindered by the pandemic. You can find more information by viewing the AACU application process video for details. The second step, submitting your high school or college transcript, has been given some consideration by North American colleges and universities. For example, your high school may have only issued pass-fail marks, or your classes may have been taught online. Don't worry. Your Adventist colleges and universities have all made plans to be able to accept your classes that are on your transcript. There are tens of thousands of students in the same situation as you. Our universities have created these plans, and we want you to know that you will be considered for admissions. Of course, the plans will vary from university to university, so be sure to visit your university's website for details. The third step is submitting your ACT or SAT scores. However, we all know that these exams have been canceled around the globe and that many high school seniors are feeling uncertain about university admissions. Again, we are here to support you. Many universities have opted for test optional admissions, or they have set up alternate dates or solutions for testing. Another reminder that the process is not the same at all colleges and universities, and that you will want to check the website of the school that you are interested in for details. So how has the pandemic affected admissions? It has given you more options while giving us the ability to adapt and to be more flexible to meet your needs. One thing that hasn't changed is this piece of advice. Don't wait to get started. Your universities are still working for you. God bless you as you finish this academic year in preparation toward university.